Second thing I wanted to mention is just because we haven't talked about it a lot is atrial fibrillation. When people go into atrial fibrillation, and there are about almost 3 million Americans who have atrial fibrillation, and many people have it intermittently. When you have it, it reduces your cerebral blood flow by about 10%. It's not a huge amount, but again, we're dealing with trying to get you optimized and trying to get you over a threshold. So it is absolutely a risk factor for cognitive decline. Well, what's come out recently is very interesting. Number one, many people have it in association with gastroesophageal reflux. So a group just took people with atrial fibrillation and just treated them for GERD, and 28% of them got rid of their atrial fibrillation. So it is a critical and often overlooked factor. So if you've got atrial fib, and especially if you're getting it intermittently, please check with your physician about that. Another common contributor, again, often not picked up, is sleep apnea. You get that burst of adrenaline, you get that burst of hypoxia, both, and it's a horrible thing, and it induces people to go into atrial fibrillation. A third one is literally anatomy. So people with hiatal hernias, increased risk. It will literally push against. And with respect to the esophageal reflux, what was shown is really interesting. The esophagus comes literally within 4 millimeters of the atrium. So you just have a little local inflammation there, boom, that sets it off. So this is a common contributor. And then, of course, stressful events, poor sleep, all these sorts of things are issues, as well as thyroid. So, Anne, in your patients, how often do you see atrial fibrillation in association with cognitive decline?
The older the person is, the more likely it is. I would say 5 to 10% of my patients have either chronic or intermittent atrial fibrillation. I've seen it occur a few times when the thyroid hormone was pushed up a little bit.
Yes.
A too high thyroid, I don't always chase the numbers. If someone has no symptoms of low thyroid, even if they might have a TSH of 4, I won't necessarily push that thyroid hormone level up because, it's a risk. So especially in someone who has any history of atrial fib. I have a few patients. One of the interesting things, I've looked at the research because I've had a few patients who I would expect to be in optimal health. They're generally men in their 65 to 75 who are extremely athletic. These guys who have been out riding their bike, doing 50-mile bike rides, 75-mile bike rides, long distance joggers, et cetera, et cetera. And it appears that there's some kind of excess stretching, the heart trying to keep up with the aerobic demand, and that excess stretching to pump more blood. And those the electrical fibers that carry the impulses get damaged in that process. Anyway, it's just an interesting thing. We know excess exercise has many downsides. There's a moderate level of exercise. No exercise is bad. Excess exercise can be bad.
Is a good point. And of course, as you mentioned, the stretching of that hypertension, of course, is another risk factor for atrial fibrillation. And one of the things that's come out of some of the functional medicine studies is how good magnesium is for this. Just striking. And people have literally managed them and stayed out of it just by taking some magnesium, each, especially if they're getting it at night, taking it, at night. So can be very, very powerful. So just another thing to consider. And as you said, Anne, too much exercise can be an issue as well as too little exercise.